So my name is Veena Sriram. I'm an assistant professor in global health policy at the School of Public Policy and Global Affairs, and I also have a joint appointment with the School of Population and Public Health here at UBC. So I grew up in Chennai, India. I grew up in a family of physicians and people working in the health sector, and from a very young age was very keenly aware that there was deep inequities in the types of healthcare that different segments of the population receive. And so in my career, I have kind of gravitated towards public health as a way of addressing those inequities. But the reason why I do the work that I do, my main goal is to see how we can make policy processes related to health more inclusive, more transparent, and ultimately more equitable. One of the reasons we see so much disparity when it comes to health, we've seen this with COVID-19, is that our policy frameworks are not set up for equity. And the policy process is one of the core reasons for that. It's whose voices are at the table, who gets heard and who doesn't. So global health, I think as we're seeing now with COVID-19, I think the definition has really evolved from thinking about global health as the health of populations in low and middle income countries to really thinking about health and health equity everywhere. The idea I think now with global health is that we really, instead of focusing on borders, we should be focused on inequities in health, whether that's here in Vancouver or whether that's in New Delhi in India. In terms of my work in global health, so I really focus on the politics of health policy processes, particularly in low and middle income countries, but with an increasing focus on Canada. My specific area of work is around how governments engage with interest groups such as professional medical associations, hospital industry groups, different interest groups that have an interest in shaping health policy and trying to understand how those interactions really affect the kind of policy that we see. Ultimately, what does that mean for health equity? And that's been the core area of my work thus far.